Hello, and welcome to show number 2616 of Eyes on Success, a weekly program empowering the visually impaired with expert advice, personal stories, and the latest in technology and accessibility. I'm Nancy Torpey.
And I'm Pete Torpey.
And everything that we're doing is very goal-oriented in a low vision exam, and so the premise of the exam is that they come in saying, there's this task that I am not able to do in the way that I would like to do it because of my vision. And we run through all of the different types of options. And there's a lot of considerations that go into what is going to be the most helpful device for that patient.
Not everybody may know about low vision specialists, and not everybody is recommended to see one. But in today's episode, we'll let you know why both of those are important.
We'll talk with low vision optometrists Dr. David Simpson and Dr. Cade Oost about personalized evaluations, tailored tools, and goal-based strategies that help people stay active and independent. And most importantly, what's really special that a low vision specialist can provide to you that your regular medical team might not be able to do. But first, for a tip of the week. This week's tip comes from David Simpson.
Kind of getting back to lighting, I think it's a simple recommendation that I make all the time, are using neck lights, and specifically not necessarily reading neck lights, but looking for things that like mechanics or people in construction might use. So if you go to like a hardware store or an auto supply store, the types of neck lights that you can get at those places, I think, are often more helpful for people with vision loss. And that's a pretty common recommendation that I'll make for patients. And it's probably the most common thing that people come back and say, oh, I'm so glad you recommended those neck lights.
Lighting can make a big difference.
Yeah, absolutely.
And even for people who are fully sighted, when the power goes out, it is really handy to have those things around.
Yeah, usually patients say, I bought one for myself and I bought one for my partner as well.
Support for Eyes on Success is provided by
the My Tools for Living retail store at the Chicago Lighthouse, offering tools and technologies to support everyday life across the vision loss spectrum, as well as ongoing advice. More information is available at mytoolsforliving.com.
You are listening to Eyes on Success. Success, 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 success.
Let's start by meeting David and Cade.
We have two guests with us today who are both low vision specialists, and I thought we could start out by asking you, Dr. David Simpson, to introduce yourself.
Sure. Yeah. Thanks for having us on the show today. So my name's David Simpson. I'm an optometrist, and both Cade and I work out of the Sue Ann Schutz Rogers Eye Center here in Aurora, Colorado. So I guess my background is I went to optometry school. I didn't necessarily know exactly what I wanted to do after graduation in kind of the world of optometry. I ended up doing a residency in low vision rehabilitation at the William Feinblum Center in Philadelphia, Pennsylvania. And then after that, I went on to teach at the Northeastern State University, Oklahoma College of Optometry, where I taught the low vision rehabilitation course there and was the chief of low vision services. And then for the last, I guess, 4.5 years or so now, I've been working here in Colorado at the Sue Ann Schutz Rogers Eye Center, which I see patients here 5 days a week.
And our second guest you alluded to was Dr. Cade Oost. Can you tell us a little bit about yourself?
Yeah, absolutely. Happy to be here. Thank you, guys. So my name is Cade Oost. I work with David Simpson at the Sue Ann Schutz Rogers Eye Center in Aurora, Colorado. I went to the Southern California College of Optometry, grew up in Los Angeles, and I kind of fell into low vision rehabilitation while I was working on a master's research project on retinitis pigmentosa, which is a genetic blinding eye disease. And once I got involved in the low vision community, I just kind of got more and more interested in it. And I did a residency in low vision rehabilitation up at the UC Berkeley School of Optometry in Northern California. And then for coming up on 2 years now, I've been out here in Colorado, doing full-time low vision rehab, working with a wide variety of patients with different types of vision loss.
Primarily today, we're going to be discussing what you guys do as low vision specialists, but I'd just like to comment, from your perspective, it would seem that being a low vision specialist would be more interesting than being a kind of garden variety optometrist because every patient is so different.
Yeah, I think that's one of the fun things about the job is that, both on a personal level, you really get to know your patients really well because we have to spend a lot of time talking about exactly what their needs are. So I think there's the human interest component to it. And then also I kind of look at every patient that I work with. We're always trying to solve a challenge that they're having. So there's always almost like a problem solving element to it that, I don't think you always get in other types of optometry or eye care. So I certainly enjoy getting a chance to work in the low vision field.
Yeah, and we work hand in hand with the kind of primary care optometry teams, and we really rely on each other. But my interest is definitely in the low vision arena, and I agree with David. I think the variety makes things so challenging and interesting. I spent a half hour the other day learning the mechanics of how to play bridge because that was the main goal of one of my patients, was to be able to see their cards when they're playing bridge. Or the week before that, learning, the intricacies of how to tie a fly on a fishing rod because that was the patient's main goal for the day. And I think doing something that is so goal oriented really helps you get to know kind of the individual life of the patient. And it's always an interesting and varied time.
So one of the reasons for doing a show on this topic is that it seems like very few people know about the special services that low vision specialists can provide. And often ophthalmologists don't refer their patients to such people and sometimes don't even know where those resources exist. So before we get into talking about some of the special things you can do for people, make clear for people the distinction between the various types of ophthalmologists, opticians, etc.
Yeah, so the 3 O's that we usually talk about are ophthalmologist, optometrist, and optician. Just to kind of delineate, the ophthalmologists go to medical school and they specialize in ocular health after medical school through residencies and fellowship programs. They generally act as the eye care specialists. So ophthalmologists often subspecialize in retina or glaucoma, and we're often going to them for management where we need surgery or where we really need a specialist's opinion. Optometrists go to optometry school, so their schooling is specialized to the eye from day one, but it's a different program from medical school. And they are acting as kind of the primary care eye providers in a lot of settings. So they can manage a lot of ocular disease, and they can subspecialize into things like contact lenses or low vision rehabilitation, which we do. But both of those are doctorate level programs. The opticians are the folks who specialize primarily in the manufacturing of glasses. And so their specialty is fitting and manufacturing the lenses and helping patients get the glasses prescriptions filled, and the prescriptions themselves they're getting from their optometrist or ophthalmologists. And then within optometry, a lot of different subspecialties. Ours is low vision rehabilitation, and I'm happy to let David chat a little bit more about low vision rehab.
Yeah, one of the major distinctions that I'll make with patients when they come in to see us is that either their optometrist or ophthalmologist who did refer them in to see us, their primary focus is often on addressing directly the health of the eye. So are there medical treatments, are there surgeries, injections, medications, those sorts of things that can help address their specific condition, say macular degeneration or glaucoma or a wide range of other conditions. When they're in to see us for a low vision optometry evaluation, I will tell patients that what we want to focus on is the function of the vision. So regardless of their level of vision, how do we take the vision that they do have and use it to be able to achieve the goals that they want to be able to achieve? So Cade alluded to a few types of goals that patients may have. So tying a fly or reading is a common goal, or being able to see a sporting event So there can be a wide variety of things, but we want to focus in on helping them receive the tools that they need, and as well as things like resources or other adaptations that can help them achieve what they want to be able to do.
And my impression is that one of the biggest things that you folks do is to help people improve their quality of life. You know, people lose their vision partway, all the way, whatever, and all of a sudden they're like, oh no, I can't do what I used to like to do. Now what? And you guys have a huge bag of tricks that you can implement to help people be able to do what they want to be able to do. So can you kind of review some of the varieties of tools and techniques that you've got available?
Yeah, absolutely. So one of the primary tools that we use are glasses prescriptions. That's always a good place to start, is seeing if we can optimize the vision by adjusting the glasses. Outside of the glasses prescriptions, we rely on a lot of different gadgets. Primarily, the two most common things we're looking at are types of magnifiers and different lighting adjustments that we can be making to help sort of optimize the vision that a patient has. The magnifiers, there is a wealth of different options. There's electronic and video magnifiers. There's optical magnifiers, kind of a different magnifier for every task you can dream of. But a lot of our focus is on how can we make things larger and enhance the contrast for patients who are grappling with vision loss.
And you mentioned eyeglasses, but you don't just make regular eyeglasses. You have all sorts of fancy lenses and gadgets and stuff that you can incorporate into the eyeglasses, right?
It can be a pretty wide range of prescriptions that we do with eyeglasses. So it can range from a straightforward, say, distance or reading prescription, similar to what you would get from a standard optical. A lot of the time we'll get into maybe stronger glasses. People ask, well, can you just make my glasses stronger to make it easier for me to read? And that's possible to do, although there's a trade-off, which is that you have to hold things in closer. Those lenses are often, say, thicker lenses. They may also require prism in them to allow the eyes to work together. So in that sense, some of the prescriptions that we'll write out may look a little bit different than what patients receive at other eye doctors as well. And then, as you mentioned, we can start to integrate other tools into a pair of eyeglasses. So things like a bioptic telescope, which is a pair of glasses that has a telescope that's built into it that allows a patient to access distance magnification without having to hold up something like a monocular handheld telescope. So yeah, it kind of runs a whole gamut in terms of what we can do for things that patients are able to wear, including nowadays, we're starting to see more and more integration of technology like smart glasses as well. So yeah, glasses and things that you can wear is probably a broader discussion in a low vision optometry clinic than it may be in other eye care settings.
That's what got me through my undergraduate education was handheld monocular. They weren't building them into glasses at the time.
Yeah. And that's the thing that, Nancy, you mentioned working on quality of life for the patients, and things like a bioptic telescope, if somebody's always constantly having to hold up their handheld telescope, having a way to access it without needing to hold it up all the time can make the life more convenient and hopefully improve the quality of life as well.
And these would be glasses akin to what our dentist usually wears so that they can see a magnified image of, in this case, our teeth, but in your case would be whatever they're looking at.
The occupational magnification lenses that we usually think of for surgeons and dentists work in a very similar way. We think of the occupational glasses as microscopes as opposed to telescopes because they're designed to help us see things that are closer up. So if a dentist is working, in somebody's mouth, they need near magnification versus a telescope is typically something we think of for distance magnification. But it is a very similar concept. And so we can take those concepts and apply them to a huge range of different visual tasks and needs depending on the patient.
And you mentioned also these days we have a variety of electronic and digital options.
Yeah, I think that's something that's probably changed a lot in the field of low vision optometry over, say, maybe the last 20 years or so, is that I think initially the field started out where a lot of the focus was on what we'd consider optical devices. So things like magnifying lenses and telescopes. For a typical day for me nowadays integrates more and more electronics, including, things that you can do on the cell phone and other, smart gadgets that can, help assist people with vision loss as well. So I think it's something that we'll continue to see change, in terms of what does a low vision optometry exam entail.
So you raised an interesting point. Most smartphones have built-in sophisticated magnification options. Is part of what you do training patients in how to use these tools that they probably don't even know they already have?
Yeah, absolutely. That's something that I'm doing on a almost daily basis, is unveiling that there's already a magnification app on most of my patients' iPhones that they can be using. And I would say, especially when we look at the younger population, the pediatric population with maybe inherited eye diseases or other causes of low vision, and younger patients who grow up just extremely tech savvy in a way that most other generations haven't, is that they are relying more and more nowadays on their phones, on their tablets, on other electronic magnification devices. And with older generations, it can often be a little bit more of an uphill battle to build comfort and technological literacy with some of those devices. And so that's one area where we often partner with occupational therapists to help do more long-term training on assistive technology options.
Yes, sometimes it can be very tricky to get some older people to get to use these devices that could be helpful if they were just receptive to it and knew how to use them.
Yeah, you kind of have to meet the patient where they're at as well. So as Cade mentions, a lot of the people that we deal with, really regardless of age, can be very tech savvy nowadays. But if somebody doesn't have an affinity for using those sorts of products, I think there's still a major place for some of our more traditional tools as well. And I think that's one of the things that we try to get across during an evaluation, is that there's a lot of pros and cons to any sort of device that can be used to help people with low vision. And so from that standpoint, helping the patient leave with an understanding of what all those pros and cons are is a part of our job.
Yeah, absolutely. And everything that we're doing is very goal oriented in a low vision exam. And so the premise of the exam is that they come in saying, there's this task that I am not able to do in the way that I would like to do it because of my vision. And we run through all of the different types of options. And there's a lot of considerations that go into what is going to be the most helpful device for that patient. So technological literacy is one, but depending on the device, there's also other medical considerations and postural considerations. Do they have to be sitting in a chair to use a device? Do they have to be leaning to use a device? Are their hands steady enough to hold a certain device? Do they need to be using both hands to do the task and they can't hold a magnifier? And so there's all sorts of options and so many different considerations that comes into play when figuring out what is going to be the best option for that specific patient and that specific goal.
So we talked about a slew of kind of high-tech options. Can you review some of the more low-tech solutions that might be helpful to people that you often recommend?
Yeah, our friends are fascinated by how Pete folds his cash. And I can't tell you, once I showed one person about the large purple 5 on the $5 bill, how many of our friends are like, oh, show me, show me.
Oh, yeah. So, and that's the thing, is that when we're meeting with patients, it's often the first time they've really been introduced to concepts that can help them to address their vision loss as well. So I think it's important not to overlook the simple things like you mentioned. Because, we kind of come from a more optical background. A lot of our suggestions are going to be related to what we are capable of doing, say with glasses, as we were discussing earlier. I think lighting is another big suggestion or a big discussion that we'll have with patients. And, a lot of people who are referred into us who may be struggling with day-to-day tasks, if we just focus on magnification, sometimes we're going to overlook how to best address the issues that they're having. So I'll often suggest things like neck lights. And nowadays with LED lights, you can get pretty bright lights in small packages, which is another thing that a lot of patients aren't necessarily aware of. when I was growing up, we'd have these huge camping flashlights that were kind of a pain to carry around, but now you can get super bright lights and something that you can slide into your pocket. And that can make a big difference in terms of being able to perform different tasks.
I guess one of the interesting things that have come along more recently are some of the smart glasses. So we don't have to hold up a cell phone anymore to take a picture or have some AI look at a scene for us and describe it to us. Are you suggesting those to some of your patients these days?
Yeah, absolutely. And I would say probably the biggest change in the last year has been that we've had some of this technology available for a while, and some of the low vision specific tools that have been available to patients. But given the consumer electronic options nowadays, the cost of these smart glasses has come down so significantly. And so often we'll have patients coming in asking about them, without us needing to bring them up in the first place. And so being able to answer those questions, I think has really become a big part of the exam and has opened up a lot of opportunities for people with vision loss.
And that technology is changing very rapidly these days. I see new devices coming out almost every week, it seems like.
Yeah, and I would say in our clinic, the ones that we're working with most commonly at the moment are probably the Meta glasses, although you're right, there's a host of other options that are coming out. Some are designed more specifically with the low vision patient in mind, and some are more, broadly marketed like the Meta glasses. I think one of the key considerations at the moment is that these glasses are usually acting as a sort of sensory substitution. So if I'm not able to see something with my own vision, I can ask the glasses to take a photo and interpret what is in front of me and get audio feedback instead. We're still a ways away from these glasses being able to do any sort of magnification on the lens themselves. But that would be kind of a long-term goal as well, as being able to get not only auditory feedback, but also magnification from these sorts of smart glasses.
I thought some of the older generations of smart glasses had a display in front of the user's face where they would display an image in a format that was easier for the user to see rather than looking at the actual object in front of them.
True. There are electronic displays that are wearable electronic displays. A lot of them, depending on who you ask, they may not be lumped into the category of smart glasses because they tend to be just a magnification device that is wearable. So they're a little separate from what we typically think of as the mainstream smart glasses that have been hitting the market in the last few years.
Yeah. I kind of think of wearable options for people with low vision into two categories. The smart glasses, which are going to provide, at the moment, more audio feedback that Cade discussed, and then the head-mounted video electronic displays. So in those cases, those give you visual feedback, and similar to what Cade mentioned, those are things that can provide magnification. A lot of the time there is audio built into them, so some of them have OCR, optical character recognition technology, so it can read some things back to you. So there is some overlap back and forth, which I think can sometimes cause some confusion as well. I can think of a patient yesterday who came in kind of wanting interest in Meta glasses, but expecting them to have some of these visual features in them that they're not really designed for at the moment. But, both, I think, depending on the exact goal of the patient, can be great options for patients.
And then you would refer people out to a training center if they need help doing safe behaviors while cooking or whatever. That's not really something that you would particularly address yourselves.
Yeah, there can be a little bit of overlap there. We're fortunate to have occupational therapist who works directly with us as well. So that's one of the common referrals that we'll make, but also working with other community-based resources, as you mentioned, depending on the exact needs of the patient to look at adapting things around the home as well.
Yeah, I would add that low vision rehabilitation is fundamentally interdisciplinary, and the low vision optometrist plays a really critical role in that rehabilitative journey, but there's a lot of other professions and specialists that can get involved, like occupational therapists, certified low vision therapists, orientation and mobility specialists, assistive technology specialists. There's a lot of different nuanced needs of these patients. And so when it comes to a lot of the more day-to-day activities of daily living and independent living skills, we often lean more heavily on our occupational therapist colleagues and certified low vision therapist colleagues.
And I think because sometimes we are the first contact point for people going through their experience with vision loss, I think helping to guide people through that journey and connect them to all these different resources is also a big part of our job.
So we talked a bit about how difficult it can be to find low vision specialists. What recommendations do you have for people who do want to find a low vision specialist?
So a lot of our patients are people who are already seen within our system here at UC Health. But we do accept patients with outside referrals. Usually the first step is to get in with a primary eye care provider, either an optometrist or an ophthalmologist, who can do the initial evaluation, because we still want to determine, is there any treatment that could be necessary, or again, things like glasses or contact lenses that could help address somebody's vision loss. So we want to make sure that patients have had those evaluations first, but then I think it's appropriate for patients to kind of advocate for themselves and say, I'm really struggling with these daily tasks. I'm not sure that I'm able to achieve them, say, with just glasses, or even after I've had this surgery or treatment. Is there anything more that I can do? And specifically asking, is there a low vision provider that you can refer me to?
And do you have a website where people can go to see what kind of services you do offer and familiarize themselves with your services?
Yeah, I was trying to pull that up because I don't know that we have a catchy URL to get people directly to our website, but it's through the University of Colorado Anschutz Medical Campus. So it's the Sue Anschutz Rogers Eye Center. Through the website for the Eye Center, there is more information about the Low Vision Clinic.
There are two websites for the CU Anschutz Low Vision Clinic, and since those are rather lengthy, we'll have both of those in the show notes.
Is there a phone number?
Yes. So if you want to call the eye clinic, so 720-848-2020 or 720-848-2020 is the way to get in touch with the Eye Center here.
If people had questions for either of you, is there some way they could contact you?
Yeah, I'm more than happy to provide my email address as well for folks that have any questions about the services we offer, about low vision more generally. So this is Cade Oost. The email address to get a hold of me would be cade.oost, that's cade.oost, at cuanschutz.edu.
How do you spell Anschutz?
ANSCHUTZ.
And you, David?
My email is same format as Cade's. So my first name, David.Simpson, spelled like the TV show, SIMPSON, at cuanschutz.edu.
And if you missed any of that in the audio content in the show, you can always find it in the show notes for this episode, which is episode 2616, along with other resources.
That's it for today's show. Next week on Eyes on Success, we'll be talking about support service providers for deafblind Coloradans. Support service providers, or SSPs, play a vital role in helping people with dual sensory loss stay informed and independent. We'll talk with SSP Vicki Scarborough about guiding techniques, tactile communication, haptics, mentoring, and Colorado's state-funded program that connects trained SSPs with deafblind individuals.
You've been listening to Eyes on Success, available wherever you get your podcasts.
For show notes, resources, and more information, visit our website at eyesonsuccess.net.
Thank you for being part of our community. Until next time, I'm Peter Torpey.
And I'm Nancy Goodman Torpey. Thank you for listening.